Scorching temperatures and oppressive heat have led to more emergency room visits across the U.S. According to the CDC, there have been extremely high rates of heat-related illnesses in parts of the country, and the summer has only just begun. Dr. Owais Durrani is joining us now to talk a little bit more about this. He's an emergency medicine physician. So, man, I know that the heat can really sneak up on people. Can we talk about just what sort of things you're seeing in emergency rooms because of the heat wave?
Yeah, absolutely. I appreciate you having me. Look, I think heat is something that sometimes we take mildly, but if you look at heat-related deaths last year, it killed more people than hurricanes, tornadoes, wildfires. So it's a silent killer, but it is a killer. And that correlates to what I'm seeing in the emergency department. We're seeing everything from kind of more minor things to like sunburns with kids playing outdoors, to moderate dehydration, to then more severe things. You've probably heard of heat exhaustion and heat stroke. And so that kind of lies on the spectrum. And you see things where people start to get cramping, nausea, vomiting, lightheaded. Those are kind of the more milder symptoms in the heat exhaustion category. And then we see things like heat stroke, where our organs stop working because of how high that core body temperature gets. And that leads to things like slurred speech, difficulty walking, confusion. And so those are things that, unless they're treated immediately, will kill you. And so lots of kind of scary situations when it comes to the heat. And I think we need to talk about it in a serious manner, just like we do about tornadoes and hurricanes.
So, let's talk about it. So are certain people more susceptible to heat-related illnesses, or really are we all vulnerable?
So we're all vulnerable, obviously, with various things. Some of us are going to be more vulnerable. So kids, those with comorbid conditions, and the elderly are going to be the most vulnerable. Kids are going to get dehydrated really quick just because of how their body surface relates to their internal body area. They're also going to get sunburned a whole bunch because they haven't built up all the protective skin layers adults do. When it comes to comorbid conditions, so if you have congestive heart failure, heart disease, COPD, diabetes, kidney or liver issues, you're going to be much more susceptible to getting dehydrated, to balancing your electrolytes like a young, healthy person may be able to. And so those folks are going to be at a higher risk. And then we even see healthy 25-year-olds who work outside who come in with muscle breakdown that leads to things like kidney issues. So we're all susceptible. We all have to take this seriously, but we all have to make sure that those that are more susceptible, we keep an eye on them, check on your neighbor, check on your elderly relative, just like you would during a power outage or a tornado or situations like that.
Yeah, and you mentioned we have to treat this the way we treat, a hurricane or a tornado. And I think part of the challenge with heat is that when a hurricane or a tornado blows through, you see the physical damage to the structures all around you. Heat wave, it's not as visual. And I think because of that, people don't realize that more people die as a result of heat waves than any tornado, than any hurricane.
Absolutely. It's a silent killer. And the other thing we don't realize is that when we do have those comorbid conditions, they kind of lie in a very narrow balance zone of being sick or not sick. And so you can get thrown into, being able to deal with your heart disease to not being able to deal with it very quickly. And so that's why we have to also make sure that, we're having the conversation and getting our local and state governments involved and making sure that we have things like cooling centers and resources in hospitals so that we can take care of these people. Because unless we treat it like an emergency, these deaths are unfortunately going to continue to mount because it's not going to get cooler anytime soon.
Right. Dr. Owais Durrani, thank you very much.